bone, you think that bone is hard and all it has is calcium. There's a lot of other stuff in there. Okay? Calcium is the hard stuff. Phosphate is in there. Okay? But 1/3 of your bone has organic stuff. There's collagen in there. Okay? Which is protein. There's cells in there. Osteocytes, osteoblasts. Okay? 2/3 of it is minerals. Mostly calcium and phosphate. But there is 1/3 that has blood vessels. There's other things in there. So let's talk about special cells of the bone. Okay? There are 3 special cells. You have osteoblasts. Now, osteoblasts are going to build bone. They're going to put the matrix there. They're going to take calcium from blood and put it into the bone. That's its job. Now, the best way I kind of explain people is that if I have to paint this floor, I need someone to put the bulk down. So I'm going to get the osteoblasts that are going to pour the paint and just put it all over the place. Now, they're going to get messy. They're going to get some on the wall. They're going to get some on the desk. But they're going to keep on painting and painting and painting and painting all over to put the bulk down. And now they can't go anywhere. They painted themselves in a little corner. Right. Now they're not osteoblasts anymore if they painted themselves in a corner. Now they're known as osteocytes, and they're in a lacuna. Okay? So osteoblasts become osteocytes once they're surrounded by the matrix they just put there. Okay? Osteocytes are going to give nutrients to the bone. Osteoblasts are going to put calcium into the bone. Then we have another cell. Well, they're going to clean up the area. They're going to chip away. The osteoblasts kind of made a mess over here. So that paint, which is really calcium, they're going to be like little Pac-Men, and they're going to start chomping away at that. And you got to look at them on a microscopic level. But they're going to take some of that paint chips, which is calcium, and take it from the bone and put it in the blood. Okay? So osteoblasts take calcium from the blood and put it into bone. Osteoclasts take the calcium from bone and put it into blood. As you're seeing, calcium is important to make bones and teeth strong. We all know that, but that's really down on the bottom of the list of the functions of calcium. Calcium is much more important for nerve conduction, muscle contraction, clotting blood, and the list goes on and on and on, which means that we have to have a good supply of calcium in the blood. Not too much, not too little. We have to have a certain level there. And it's the job of osteoclasts and osteoblasts to do to get the blood levels of calcium adequate. Okay? All right, so that's osteoblasts, osteoclasts, and the osteocytes, which kind of give the nutrients, the glucose, and takes it from the blood and kind of spreads it throughout the whole bone. Okay? So, if you understand what osteoclasts do, now let's just think about this. If you have osteoclast activity that is working on overtime, what's going to happen to the amount of calcium in the blood? Is it going to go up or is it going to go down? It's going to go up. Okay? What happens, if it goes up, then what happens to your bones? Are they very dense or are they very fragile? Fragile. So if there's some kind of disease that's going to increase osteoclast activity, what is the patient prone to getting? Fractures. What I'm describing is osteoporosis. Okay? If osteoblasts work on overtime, what's going to happen to the blood levels of calcium in your blood, or in blood? It'll decrease. And what happens to the composition of your bones? They're going to get thicker, right, and denser. Paget's disease. All right? That's what I'm saying. If you know the normal, that's why I think all the systems are going to be a little bit easier if you review this. If you know the normal, if you have too much, it's a disease. If you have too little, that's a disease. Okay? system here. Okay?
All right, so on this diagram of the two guys and the bone, the guy on the outside building up, that's Bob the builder. He's building new bone. He takes his bricks made out of calcium from the blood. So when Bob needs to build up the outer layers of bone, he takes calcium from the blood and puts it into the bone. The guy on the inside is Claude the carver. He is an osteoclast. Claude is the osteoclast. Claude was the only CL name I could think of. So Claude is the osteoclast. He is carving away the interior of the bone, and as he's carving away, if you can imagine little chips of bone coming out, now this is all on a cellular level, but if you can imagine little chips of bone coming out, what he's freeing up and what he's releasing is calcium, and that calcium goes back into the bloodstream. So Bob and Claude kind of work together to maintain this balance of calcium in the bone and calcium in the blood. Calcium is hugely important, not just for bones. Bones are kind of secondary storage areas for calcium. Calcium is really important in muscle contraction and nerve conduction and all kinds of things in the body. We always think of calcium for strong bones and teeth. Bones and teeth are kind of the storage area of calcium because it's needed in so many other things in the body. So these two kind of work together. Why can't we just have Bob building up bone all the time? It would be too heavy, right? It would be so heavy that we wouldn't be able to move our skeletons. And then Claude, if Claude was left with nobody working with him, what would happen? There wouldn't be enough calcium in the bones, and we would end up with what? Osteoporosis. We wouldn't have enough calcium in the bones. If we have a calcium deficiency, then Bob runs out of bricks. Bob has nothing to take from the blood and put into the bones. The calcium is going to go where it's needed more, like to the muscles and the heart, before it goes into the bone. So Bob's like way down on the food chain as far as calcium goes. So Bob's going to be the last one to get the calcium. But Claude, he's still working away, and you end up with bones that aren't very dense, that don't have a lot of calcium in them, and then the patient's at risk for what? Fractures, right? Very good, fractures. So the idea here is that the osteoblasts build new bones, osteoclasts break down the bones. If the blood calcium level is very low, who do you think gets overtime? Bob or Claude? Claude, why? Exactly, because he's releasing calcium from the bone and putting it back into the blood. There's two hormones that work together to maintain our calcium balance. One puts Claude on overtime, the other one puts Bob on overtime. All right? So if our calcium levels in the blood are very high, then who goes to work? Bob. Bob takes the blood calcium and shoves it into the bone. Okay? All right, very good.
So in a child, now I'm using abbreviations here. OB for osteoblast and OC is osteoclast, not osteocytes. So just look at the legend here. But in a child, you have a higher amount of osteoblastic activity than osteoclastic. That makes sense, right? In an adult like you and I, it should be equal. But something to look forward to as we get elderly, the osteoclast activity is much more than the osteoblast. And that's why we're more prone to getting osteoporosis. Seeing osteoporosis in a 12-year-old kid, just don't see that. Unless something's happening. But that's very rare should that happen. It's more common 65 years old. Okay? Sound good? All right, so let's look. I'm not going to ask you about the percentages here, but let's look at the composition of bone. All right? 1/3 of bone is organic stuff. The cells that we just talked about, osteoclasts, osteocytes, and osteoblasts, right? Plus all the collagen that's in there. That's going to be 1/3 of bone. 2/3 of the bone is going to be inorganic stuff. All the minerals, which is the majority of this, and phosphate. Now, calcium phosphate crystals, which is the majority of this of bone, is a fancy word. We call it hydroxyapatite. All right, so if you see that word, that's what that's dealing with. It's calcium phosphate crystals, which is the majority of what bone is. Okay? Put sodium, potassium, with everything in there. All right, so let's talk about how do we regulate calcium. I've kind of emphasized to you that, yes, we need calcium to make, muscles contract and nerves conduct, clotting. But we need to make sure there's a certain level of calcium in it. Well, it's hormonally regulated. All right, so the endocrine system is coming in here. So we have a hormone called parathyroid hormone, PTH. This is from the parathyroid glands, which is found posterior to the thyroid. And when levels of calcium are very low in the blood, this gets secreted. And it's going to increase calcium in the blood. Okay? Then we have another hormone called calcitonin. This comes from the thyroid gland. This is going to get secreted when levels of calcium are very high in the blood. That's going to tell the thyroid, secrete calcitonin to tone down the calcium. There's a nice mnemonic for you. Okay? So where are they going to do this? Where are they going to target? Well, there's three places it's going to target. First off, it's going to target the bone. Just so what we talked about, turning on and turning off osteoclasts and osteoblasts. If it's PTH is going to target bone, and is it going to turn on osteoclast activity or osteoblast activity? Think about what it has to do. Low levels of calcium in the blood. Here, let me do it this way. Okay. So if we have a decrease of calcium in the blood, right? That's going to make is it going to make calcitonin come out or PTH come out? If you have a decreased amount of this, PTH. So that means PTH is going to come out. PTH is going to go to bone, and it's going to do what to osteoclasts? Increase or decrease? Increase osteoclastic activity, and what's going to happen to calcium in the blood? Increase. Does that make sense? Right? If this gets too high, because this will keep on going, now it's going to get too high. So now, that's too high, PTH is not going to come out anymore. Instead, it's going to turn on what? Calcitonin is going to come out. If you increase calcitonin, what's that going to do to osteoblast activity? It's going to increase osteoclastic activity. Right? Does that make sense? Yeah. And then it's going to do that. And if it gets too low, it's a thermostat, right? If there's supposed to be 70 degrees in this room, if it goes to 80, your AC will kick on. If it goes down to 60, your heater will kick on. It wants to keep that happy medium. So this is going to decrease the calcium. It's going to tell PTH to come out. Goes to bone. It's going to increase osteoclastic activity, and it's going to decrease osteoblastic activity. Does that make sense? Right? Then your calcium goes up. It'll keep on going up. So now it gets to a point you can't do too much. Calcitonin comes out, tells the bone to increase osteoblast activity, but also decrease osteoclastic activity. And you got this. Same principle when we get into insulin and glycogen. So we're dealing with glucose. Okay? Is that clear? Now, parathyroid is also going to go to kidneys. Kidneys are going to make you pee calcium. We don't want that. So if PTH comes out, it tells the kidney, don't make it go out. You want to reabsorb it. It also goes to the intestines and says, if you're eating food, we need to really absorb all the calcium that's in your food into our bloodstream. So what PTH is doing is everything in its power to get calcium higher in the bloodstream. Calcitonin goes to the same three targets, but they do the opposite effects. Okay? So the next two slides, this is the PTH, goes to bone, intestines, and kidney. And you can read this, what I just explained to you, but that's what's happening to try and get calcium levels higher in the blood. This next one is calcitonin, goes to the same three organs, but does the opposite effects so that we can lower the calcium in the blood. All right? It's not too bad. Really, that's dealing with growth, not too much about calcium, although it deals with that too. So we have calcitriol, which is really, this one actually deals with calcium, as the name implies. This works just like PTH, but it doesn't come out of the parathyroid gland. This is actually vitamin D that is made by your body, and we need the skin, liver, and kidney to make this. What does vitamin D do to get calcium up? Well, it targets the intestines, and it says whatever food is going into your intestines, it wants to enhance calcium absorption. Okay? So you do need, that's why you have to be in the sunlight. Now you don't need a lot of sunlight. You only need about 45 minutes a week, all right, for your skin to get that absorption from the sun to make this. But it's in a lot of foods. It's in cereal and stuff like that. Okay? We also have growth hormone. Growth hormone gets released by the anterior pituitary, but it goes to all the cells to make everything grow. It's not really about calcium, but really make everything grow. It goes to the heart, goes to the hand, goes to the eye, goes to the nose, goes everywhere, just makes everything grow. We also have the thyroid hormones that is going to also contribute to growth throughout your whole body. So T3 and T4 are going to happen there. And then we also have the sex hormones, estrogen and testosterone. Right? There's a lot of that coming out during puberty, and all of a sudden, your children are growing up much faster than what we expected because you got this growth spurt because of all this extra testosterone and estrogen is coming out. So again, if you know that all this is happening, well, what happens if someone has a low amount of thyroid? They're not going to grow. It's not going to grow that high. Growth hormone. So if you know what they do, you have an idea it's not going to grow that high. Growth hormone. So if you know what they do, you have an idea of diseases. You've got to know their normal functions. Okay? So you have hypercalcemia. We have too much calcium in the blood. You get kidney stones because your kidneys get overwhelmed with all this calcium that it can't make it go out in your pee. So you start clogging up and it starts crystallizing, making these stones. You get brittle bones. Does that make sense, right? Because osteoclast activity is too much. That's why your calcium is high in your blood. You get confusion and muscle weakness because, like I said, it makes muscle contraction. You get nerve conduction. And stomach ulcers, we realize that people with a lot of calcium actually makes more acid come out of the stomach, and it causes ulcers. So my little mnemonic on this is stones, bones, groans, and moans. Right? Stones, bones, groans because your stomach, and moans like, right? Whatever you want to use. All right? So that's a little mnemonic there. Then you also have the hypocalcemia, where there's a decrease of calcium in the blood, and this mainly affects the nerve conduction. So you get these tingling sensations like pins and needles in your hands, and muscle spasms. Again, contributing because of the nerve conduction that's happening.